Our mission is to empower people to help them make good financial decisions. It's our job, our mission is to go out, educate people so that they can make an informed financial decision and get to where they want to be financially.
MFP specializes in really understanding who you are. What is your mission? What are you trying to accomplish? And we believe that everybody should make informed financial decisions. So our skill set is understanding who you are at your core, walking you through multiple options of the different ways that can get you to where you need to be. And then together, we will build that plan together. It might be a retirement income plan. It might be a legacy plan. It might be sending all your kids to college. It just might be saving money on taxes. But whatever is most important to you, we will build a plan that reflects that.
One of the biggest motivators for us as a firm is we want our clients to get to where they want to be. It's not just from we want to sell you something, right? It's we want to be an important part of the path that got you where you wanted to be.
When we say empower people, I'm really meaning like most people in financial services to get talked at, not talked to. So they talk at them and say, hey, you should do this, you should do that, instead of saying, hey, what's important to you about X, whatever that X is, that X factor that's important to you, and understanding them through their lens, and then saying, okay, here's how we can build something that'll get you to what you said was important, and here are the action steps that you need to take, because sometimes all problems can't be solved with one action.
We are helping people make informed financial decisions because ultimately, everybody has different goals, everybody has different things they're working towards, and there's nothing worse than trying to make a decision and you don't know what to do, right? Like maybe you're reading something, you don't even know what it means, right? And so our job is to help you make those informed decisions so you can confidently get to where you want to be.
The vision for Mission Financial Planners is ultimately to develop a network of like-minded fiduciary professionals, one that we're able to take care of all of our clients' needs. And we start with financial planning, but it's going to grow. And what's really exciting is we don't know exactly how it's going to grow. It might be everything from one day we're bringing in a Mission Financial individual that is helping with your P&C insurance, that's helping you with your real estate, purchasing investment properties or selling and buying your forever home. Whatever it is, if it takes good advice, I would love for one day that we provide that, and it's with somebody within our network. People and businesses should work with Mission Financial Planners ultimately because of the skill sets that each of us bring. Myself through the process, Matt through his ideas, Jason through his deep understanding of advanced plannings and the tax laws. All those together get our clients to a place that sometimes transcends their initial goals and expectations.
MFP is a culture of learners. That's just the culture of our business, is get better so we can make our clients better.
And the reason people should choose Mission Financial Planners is because we're holistic. We look at the whole picture. We're not just a portfolio manager. We do look at the whole picture. And that's why people should choose us.
Hey, good evening, everyone. It's Matt Donahue and Ken Hamilton again. Thanks for coming back. Hopefully we didn't scare you off last week with everything we taught you about Social Security. Tonight we're going to talk about healthcare, which for a lot of people can be a very scary conversation, especially when they start thinking about what covers what, how much is it going to cost. Oh my gosh, there's some tax traps involved, all these different things. So when we think about managing healthcare and expenses, we're not just thinking about how does Medicare work, right? Do I need a long-term care policy, things like that. It's what's the plan? How do we make sure that we manage the costs so that we're not tapping into other accounts that maybe are going to create taxes for us when we do pull money out for whatever reason? And so this is sort of a segue, if you will, into next week's presentation, which is going to be on tax planning. But just remember, what we're here tonight to do tonight is to help you make informed financial decisions about healthcare as you're thinking about retirement, as you're getting ready for retirement, and maybe as you're in retirement. So couple things, again, just reinforcing who we are as a team. So we own Mission Financial Planners and the Valero Insurance Agency, which you can see in the top upper right quadrant there, if you will. One of the groups that we work with that actually isn't on the list is a health insurance group called Savers Marketing. And they work in all 50 states, very professional. If you are at that age where you're getting flooded with, hey, it's open enrollment, blah, 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 review your Medicare premiums, things like that, a quick phone call to them can actually clear all that up, and you can throw all that stuff in the trash or in the recycling, whatever it is you do with it, because they are very professional. They will take you through your options. They will show you what you may or may not want to think about. And then on top of that, let's say you're not quite retired yet, but one of the things you're worried about is, well, wait a second, if I retire at 62, I know I've got COBRA to extend my healthcare insurance from work for a period of time, but what happens when COBRA runs out? What do I do then? Do I have to go on the exchange and try to qualify for something? Maybe, maybe not. It's worth a phone call to Savers to make sure that you're covered in that aspect as well. And of course, people like Ken and I, independent contractors, right? Running your own business, working professionals still, right? You need health insurance too. They can help you with that. But again, one of the reasons we bring all these partners to the table is we're good at a lot of things, right? But I really want you to think of us like a general practitioner. You go to us for your checkup. You go to us to make sure that you're moving in the right direction. We bring the experts in who can help you get to where you really want to be. And again, it's all part of that certified financial planner planning process that you got introduced to last week, and that some of you have seen already with the Social Security analysis that you've done. But essentially, folks, just remember, this process still applies to healthcare. You know, it's, hey, where are you at right now? Where do you want to get to? What have you done to get ready? And then let's put together some recommendations and see what fits. And finally, of course, we got to monitor, because as we'll talk about tonight, when you think about the different stages of retirement, your healthcare needs are going to change as you age. And what might not seem like a big concern the day after you retire could be a huge concern 20 years later. So let's just make sure we've got a good plan in place that's flexible and can adapt as your life changes. So tonight's part 2. Last week, Social Security. Tonight is healthcare. Next Monday, the 13th, right? Ooh, Monday the 13th is going to be how tax planning changes through the 4 stages of retirement. And then we're going to wrap up on Monday the 20th with estate planning. Now, I've heard some people say, hey, I've got a trust. I don't need to attend estate planning. I'd recommend you do attend estate planning for a couple of reasons. One is, while you may have a trust, the question I would ask you is, when was the last time it was updated? Do you have a will with a pour over provision built into it? Do you have medical directives? Do you have living powers of attorney, et cetera, et cetera, et cetera? Do you have all those things? More importantly, do you have them all readily accessible, regardless of where you are in the world when something happens? That could be very important, right? It doesn't do you any good to have it sitting in a 3-ring binder in your desk drawer at home if you can't access it and you're visiting kids in Florida, wherever you might be, right? So please attend estate planning, even if you've got a trust in place. I promise you'll learn a lot. Let's jump into Medicare, though. So first of all, what is Medicare? Medicare is a national health insurance program. It's designed for people ages 65 and older. It's administered by the Centers for Medicare and Medicaid Services, but you sign up and enroll through the Social Security Administration. Anyone in the U.S. who's 65 and older and is a U.S. citizen and has been a legal resident of the U.S. continuously for at least 5 years is eligible for Medicare. That's one of the big myths about Medicare, and I hear this all the time from people as well. You know, people come to our country and they just take advantage of Medicare and things like that. Well, the reality is you do have to have lived here as a legal resident for at least 5 years and be 65 and older if you're going to be able to use Medicare. So that's not exactly someone, coming right off the boat and signing up for a program. Some people under the age of 65 who are on Social Security disability are on Medicare as well, but folks, they have pretty big medical issues, because the Social Security definition of disability is the most conservative definition that there is. So if you're on Social Security disability, it's pretty serious. Okay, how do I sign up? So we know it's Social Security, as I call. It's administered by the National Center for Health and Human Services. But when we think about the two different options, there's Medicare Advantage, and then there's Medicare Advantage Part C, or excuse me, Original Medicare and Medicare Advantage Part C. Original Medicare is simply for the do-it-yourselfer, right? You like to go out and shop and do all these things and figure out, really make sure you understand how it works. Hey, that's great. That's for you. And the reason I say that is you would call in to sign up for your Part A and your Part B. You might get your Part D through the federal government. You might shop it and get it from someplace else. But then any supplemental coverages you're going to get, you're going to go shopping for those as well. So you're out there, you're trying to figure out what do you want, et cetera, et cetera. Medicare Advantage, on the other hand, bundles the A and the B together. It bundles Part D in most cases, and then the agent who helps you with Medicare Advantage, they're going to be able to help you find the right supplement policies to go with it. Now, you might want to use Savers Marketing for either one of these because they're the experts. They can help you do this, but you might not, right? You might have a good relationship with someone else. That's okay, right? That's okay. Couple questions I normally get on this. What are Part A, B, and D? Well, we'll get into that tonight. Just know A is going to the hospital, B is your regular doctor visits, D is your prescription drug coverage. Okay, so A is hospital, B is going to the doctor, and then D is prescription drugs. Okay, how do I sign up? Well, the basic principle is unless you're covered by an employer group plan that has 20 or more people, you enroll in Medicare when you're 65. It's pretty straightforward, right? It's pretty straightforward. Now, someone like me, independent contractor, right? I'm probably going to sign up for Medicare at 65. Even owning a smaller firm, maybe I'm an employee of the firm at that time, I probably still want to sign up for Medicare because it's probably going to be less expensive than getting my own coverage or getting it through work. What happens if you don't sign up on time? Well, the one thing I would change on this slide is it isn't you may pay late enrollment penalties, it's you will pay late enrollment penalties. Your healthcare expenses might not be covered, right? You might have to go get some kind of basic insurance that doesn't cover everything that may happen, and your private insurance options may be limited. You still have to go through underwriting to get insurance in a lot of cases. So there are issues here that could have a drastic effect on you if you don't sign up on time. So what happens? Well, if you're receiving Social Security when you turn 65, your A and B are automatic. You can always decline if you don't want Part B. Your coverage will start the first of the month that you turn 65. But if you want to get a Medicare Advantage plan or you want to get a prescription drug plan to go with it, you've got to go proactively enroll. Okay, so that's not going to automatically happen. And again, this is if you're on Social Security. If you're not on Social Security at 65, you have 3 different enrollment periods that you can see on the screen there. You've got the initial, the special, and the general. Now, the initial, you're just not covered. You turn 65, you sign up. Special, you worked past 65, you retired, you signed up before you retired to make sure you've got your Medicare. The general enrollment period, you blew it. You didn't sign up during the initial period like you were supposed to. You didn't sign up during the window that's provided during the special period like you were supposed to. Okay, now there's this general period. So how do those work? Well, before I get into that, your coverage will start the month you turn 65 if you sign up before you turn 65. Now, the key is the month before you turn 65. If you wait till the month you turn 65, you'll get your coverage next month. You wait a month after 65, you can see it's a 30-day delay, basically. So sign up the month before you turn 65. Now, folks, what that means is if you're born on the 1st, sign up like I'm a May baby. Let's say I was born May 1st. So if I'm born May 1st, April 1st is when I should be signing up. You want to do it at least 30 days in advance because you don't want a gap in coverage. Okay. If your birthday is May 10th, you don't want to sign up on, April 30th and be like, oh yeah, it's good. No, do it at least 30 days ahead of time, at least. Now, who signs up in the initial enrollment period? Pretty much everyone who's retired, right? Now, if you're working at a smaller firm, maybe you're an independent contractor, you're going to sign up. Maybe you're not going to take those employee benefits that maybe the firm is offering you at that point. Your firm may want you to sign up anyways, though, because with Medicare in general, what happens is Medicare is the first payer of any bills that come through. And so that can really help lower the cost of insurance for the employer. So if you're turning 65 and they ask you to sign up for Part B, that's the reason why. One question we get from a lot of people about this as well is military retirees, right? They're like, hey, we're on TRICARE, we don't need this, right? There's like 3 different versions of TRICARE right now, and you're most likely signing up for Part B Medicare at a minimum, even though you're covered through TRICARE. So you're going to want to check to make sure which version of TRICARE you're on, if that's something that affects you. So who signs up during the initial enrollment period? Well, it's pretty much anyone not working. They're self-employed, small company. I touched on that. Cobra can provide an extension for almost 3 years, almost, not quite, depending on the circumstance, to continue your coverage from work when you retire. So let's say you retire at 60, you've got a window there that you can keep getting your coverage from work. Just know this though, your employer in most cases is paying a big cost or big part of that insurance for you. Okay, that's what the employer is taking care of. When you go on Cobra, you have to pay everything the employer was paying, what you were paying, and then up to as much as 2% additional on top of that. They can charge you 102% of the total coverage cost. Okay, so Cobra can be a great way to make sure you've got coverage. It's not going to be cheap though. It's not going to be cheap. And same thing, who signs up for Part D, right? It's the people who signed up for A and B, and they want to get that prescription drug coverage. Remember, you can go buy it alone, or in a lot of cases, you can get it as part of a Medicare Advantage plan. Okay, special enrollment period. You didn't sign up because you were covered. You're someone who worked past 65 and then you retired. Okay, what do? Well, to make sure that you get signed up in time for Part B, sign up any time before your coverage ends. Remember what I said before, 30 days ahead? That's a good rule of thumb to follow, right? If you know you're retiring at the end of this year, I would have a note ready to go to say, hey, last week in November is when I'm signing up for Medicare. It's that simple. It's that simple. You'll see there in the middle of the screen, it says you have an 8-month period starting the month your group coverage ends. So in other words, what that means is, let's say you retire effective December 31st, you've got the first 8 months of next year to get signed up for Medicare, and then you don't have to worry about paying any late enrollment penalties or anything like that. If you miss that 8-month window for some reason, you're going to end up paying an extra 10% per year per person on your Medicare for the rest of your life. Okay, so don't do that to yourself, right? Sign up for it 30 days before you retire. Part D, the first part of this is the same. It's sign up anytime before coverage ends. So when you sign up for your Part B, sign up for your Part D. However, with Part D, you only have 63 days to get signed up after your group coverage ends. Okay, so if I retired on December 31st, January 1st is my first day of retirement, I now have basically until March whatever to get signed up, March 1st or 2nd, whatever that works out to. So just get signed up 30 days before you retire in both cases. General enrollment period. So you missed it. You missed your window to get signed up. And by the way, the window for the initial enrollment period is 90 days. So it's up to 3 months after the month you turn 65. So again, using my May birthday as an example, if I've got the 3 months up to May, the month of May, and the 3 months after May, that's my eligibility period to sign up. If I go June, July, August, and then September go, oh, I forgot. Well, guess what? I have to wait until January to sign up, and then I'm not going to have any coverage till February. That's what this general enrollment period is for. So what does that mean? Well, first of all, I'm going to have that 10% penalty I talked about. Second of all, I may not have any coverage from May until January. And third of all, I may not be able to get coverage because I may be dealing with some kind of health issue that insurance companies don't want to deal with. So the general enrollment period, it's a way to get signed up. Just make sure you don't fall into this category so you don't have to use it. So it's a lot of information. Just remember this. The initial enrollment period, you turn 65. Sign up for Medicare 30 days before you turn 65. You'll have it the month you turn 65. Special enrollment period. Okay, you were working for somebody else, or you were working past retirement, covered under a group plan. you're retired. Remember, you've got 8 months from when you retire to get signed up for Part B. You have 63 days to get signed up for Part D. And then the general enrollment period. I missed my initial window. I missed my special window. Now I've got the general enrollment period. I can sign up anytime in the first quarter of the year. My coverage will start 1 month after I sign up. How do I sign up? Go to ssa.gov, apply for Medicare benefits, or give Social Security a call. One thing, please remember this. They are going to ask you, if you call in, they're going to ask you, do you want to have your Social Security, or do you want to have your Medicare come out of your Social Security check? You'll probably say yes, because you'll probably think of it like, hey, it's not a bill now. Well, what happens though is you may have decided to wait till full retirement age to get your Social Security, which means age 67. Right? It doesn't mean 65 for most people. It's 67 now. So if I decided to wait till 67, but then I tell Social Security, oh yeah, I want to take it out of my check, you know what they're going to do? They're going to sign you up for Social Security at 65. And that's going to blow a lot of that analysis we did before out of the water, right? So just be careful. You don't have to have it come out of your Social Security check. They will bill you quarterly for your Part B and your Part D if you are not, if you're not getting Social Security when you sign up. Medicare Part D, you can always call in to get it as well, but you can also shop it. You may be able to get it through a Medicare Advantage plan. Again, you'll want to talk to the folks at Savers Marketing about that, because they'll be able to get you pointed in the right direction. All right, and with that, we are at our first breakout session, and you guys all remember him from last week, Mr. Kenneth Hamilton. What are we talking about today, Ken?
We're going to be talking about a great resource that's at each of your fingertips, and it's actually in the handouts. So if you want to go ahead and download that. But this is a document that's published every year. We actually have the 2024. My goodness, how crazy is that? 2024 is 8 weeks away. But we have this document that comes out every year, Medicare and You. And it covers everything about what Medicare covers, what it doesn't. You look at these charts, the way that it's talking, it's exactly the content that we pulled and used to build, or rather the publishers used to create the slide deck. Now, it covers a lot of really great information, but if I have complaints about it, it's this one, that it takes 55 pages to get into what is not covered by Medicare. Now, maybe you're Medicare age, maybe you're not. I guarantee your folks probably are. But think about yourself, think about them, and I'll think about myself. I was in the marching band all through high school and college. I played way too loud. I did not wear ear protection. I have ringing in my ears right now. I had braces twice, and I have a permanent metal retainer. At some point, I'm going to need some kind of dental care later in life. And then the other thing, so dental care is not covered. Hearing aids, not covered. But the big one that is not covered is long-term care. Long-term care, or rather more specifically, Medicare, is designed specifically to cover acute illnesses, something where you are sick for a short period of time. You're sick one day, you're better the next. Medicare does a fantastic job and is one of the highest approved of federal programs that are out there. Now, with that being said, where it falls short is in chronic illness and chronic care, things that last for a very long time. And by that definition is longer than 90 days. After 90 days, or rather after 60 days, the amount that Medicare is covering is starting to reduce. And one of the things we need to be figuring out is how are those covered? How are these costs going to be covered? And in the latter half of this workshop, we're going to be talking about some of the strategies and some of the tools that you should be thinking about and how all of them interconnect. Matt, anything you'd like to add?
No. Use your resources, right? Right. Well, thank you, Ken. All right, let's talk about how Medicare is going to coordinate with private insurance. All right, so out-of-pocket costs that you end up paying. You got your Part B premiums, which we'll show you those in a minute here. You've got your private insurance company premiums. So this is going to be like your prescription drug coverage, your supplement policy, maybe your Medicare Advantage plan as well. There's other costs though. There's deductibles, there's portions of the bills that Medicare doesn't pick up. There might be services that are not covered by Medicare, which there are, right? And can kind of introduce you to that already. But the monthly premiums, if I have Part A Medicare, I don't pay for that, right? I got to have my 40 quarters with Social Security, but again, I have zero fees for my Part A. Part B in 2023, this is the doctor visits. It's $165 a month, basically. Part D, prescription drug, you want to budget for about $40 to $45 a month, somewhere in there. And again, these costs are per person. Okay, so that's $165 a month per person for Part B, plus another $40 per person for the Part D. Now, here's your premiums, and I know this is a little small, but you're gonna hear a lot about this from us as you work with us. When you look at Medicare pricing, it is means tested. What they do for means testing is they apply a formula through what they call IRMA, which is the income related monthly adjustment amount. Essentially what they do is they take a definition of modified adjusted gross income and they use that to figure out how much you should pay for your Medicare. And folks, they do it on a 2-year look back. Okay, a 2-year look back. So what does that mean? So in 2023, I am going to be paying my Medicare premiums based on what my 2020 taxes were looking at. It's 20 end of the year, 21, 22. Oop, did my math wrong. 21, 22, right? So in 2022, I would have paid on what I did in 2020. Okay, and it's modified adjusted gross income. It is not adjusted gross income. One of the things that tricks people up when they think about this, especially for those of you who own rental property, is you're used to taking a lot of deductions, and maybe that wipes out the income effect of having that rental property. Well, the modified adjusted gross income formula for this adds those deductions back in. It adds in municipal bond interest income that you received, which is usually tax exempt. So there's a lot of things that go into this, right? But if I'm in the lower bracket, and you can see it from left to right, modified adjusted gross income, single, and then joint. The joint, if we're under $194,000, you can see we've got $164.90 plus 40. That puts us at $204.90 a month. Okay, 164 for Part B, 40 for Part D, total of 204. But let's say we run, 300,000 in retirement. Okay, if I'm at 300,000, I just went down a couple brackets, right? Well, now I pay $165 a month for my Part B, but I pay another $165 a month. I pay $40 for my prescription drug coverage and another $32 for my prescription drug coverage. Now per person, I'm paying $400 a month. I basically doubled my Medicare premiums. So what could trigger that? Maybe you did a big Roth conversion, right? Maybe you pulled a bunch of money out of an IRA to pay for a wedding, right? Or do a big trip or whatever, right? But maybe you had something that happened. Just remember, if it was 2 years ago, you're not going to see it until this year's Medicare bill. And you're going to open that Social Security statement and be like, why did my Medicare double? Because 2 years is a long time, right? 2 years is a long time. So it's easy to forget. The other thing I'll say too is this is a cliff system. This is not a progressive system like income taxes are. The difference between the two, a progressive system, maybe on the first $10,000 you don't pay as much, you pay a 10% or whatever, and then on the dollars you made over say 200,000, you paid 30%. Making that up. With this though, you go $1 over, you pay the flat rate for the whole bracket, right? So what I mean is at $194,000, you're good. At $194,001, now you've got surcharges. At $306,000, you're good. At $306,01, now you've got another $100 in surcharges. So when you're doing tax planning in retirement, you've also got to be thinking about what's the impact of the decisions I'm making on my Medicare premiums, because it all adds up. I'm going to say this, do not worry about the deductible numbers you see on the screen here. That is why you will get a Medicare supplement policy. In many cases, those supplement policies can help offset the cost of the deductibles. They can also help with co-insurance as well. But one thing I want to point out, look at co-insurance here, okay? It says hospital coverage, Part A, for days 91 to 150, skilled nursing, days 21 through 100. We have a lot of people who are really confused that think that this Part A coverage here is long-term care coverage. It isn't. Okay, this is for what's called acute care. Long-term care or extended care is for chronic care. Okay, acute care is the idea that you're going to recover. You're in for a knee replacement surgery or a double bypass or whatever, right? Whatever. And you can see you can get skilled nursing care for up to 100 days, hospitalization for up to 150 days, right? But again, folks, this is stuff you're expected to recover from. This is not long-term care at all. Okay, at all. All right, your Part D coinsurance. You may have heard of the donut hole with Part D with the prescription drug coverage. Just know this: once you get up to certain thresholds, your cost goes down to pennies on the dollar. I won't say nothing because it's still going to cost you, but once you get past certain limits in terms of what you're spending on prescriptions, your cost goes through the floor. Okay, so what Medicare covers: 100% of the first 60 days in a hospital. Medicare services, some preventative services. Now, Ken talked about this a little bit. What Medicare does not cover, though, I'm going to just touch on the first four things, or I'm going to just touch on four things, not the first four. Look, numbers 3, 4, and 5. Dental care, vision care, hearing aids. Okay, Ken mentioned hearing aids and dental care, right? Vision care, glasses, it's not covered. Anybody have bifocals? What about trifocals? You got those, right? It happens, right? The other one, long-term care. It's not covered. It's very clear in the Medicare and You book that these are the things that are not covered. So a lot of people, again, like I said on the last slide, a lot of people go into this conversation thinking, oh, you know what? I'm good because Medicare is going to take care of it. It isn't. It isn't. You're going to need a supplement. You're going to need a plan for dealing with long-term care. Deductibles, co-insurance, prescription drugs, just know you're going to have to shop for the right type of Medigap policy. I tend to say Medicare supplement, but Medigap is the same thing. It's identified by letters. Just know that the more coverages you get, it is going to be more expensive. Okay, it is going to be more expensive. Oh, one last thing before I move on from that slide. Location. Costs vary by plan, company, and location. So you may live in Houston, and we got people from all over Texas on tonight. You may live in Houston, your sister may live in El Paso. Well, guess what? You're not going to be paying the same thing for your Medicare premiums or for your Medicare supplement premiums. You're not. And the reason why is because of the location. Okay, it doesn't mean that you could have the exact same coverage. One person could be paying less or more than the other. It's not because someone's getting ripped off. It's because of the location variance in the premiums. All right, Medicare Advantage. Okay, when you're signing up for Medicare Advantage, and again, this is where you're going to want to talk to Savers Marketing. With Medicare Advantage, you can get the extra benefits, right? You just got to work with an agent who's going to find the right plan. Some people really, really like their Medicare Advantage plan. It gets them in a network they like. They see the same staff. You know, it's predictable, right? It's predictable, and that's why they like it. And again, just shop for these things, right? Savers Marketing may or may not be the right answer for you. Okay. Wrapping up, we're right at the bottom of the hour. Let me see, how are we doing on time? Yeah, we're right at the bottom of the hour. Okay, so we're going to talk a little bit about long-term care before we get you out of here tonight. Before I transition into the long-term care conversation, I just want to point out a couple things. One of the biggest questions we get is, what should I be expecting to pay for healthcare in retirement? People are really concerned about that, and the cost is going to run anywhere from $300,000 to $350,000 per household over the course of a 30-year retirement. Okay, so Fidelity, the Employee Benefit Research Institute, you know, they're pretty close to each other in terms of the numbers they come out with. But just know this, folks, that's spread out over 30 years. That includes premiums, right? That includes coverages. I mean, all that stuff, right? The one thing you'll notice it does not cover, and if you look in the, according to this source over on the right there, it says not including long-term care. Not including long-term care. So we're going to talk about long-term care in just a moment. Before we do, though, enroll in Medicare on time, shop, right? Plan for higher healthcare costs. And while I get set up for their long-term care conversation, Ken is going to talk about What are you going to talk about, Ken?
So one, we're going to dive a little bit deeper into IRMA and then talk about really the overarching planning resources, which will set us up for the last breakout where we'll dig even deeper. So quite a fair amount. So the last thing I want to dig into on IRMA is make sure you understand the difference between single and joint. We had a household that's dealing with the exact problem right now, is that as a household, their modified adjusted gross income was going to be about $190,000. So they were falling into this bracket. Well, he passed away. One of the individuals passed away unexpectedly, and now the wife is in the single brackets. Take a look at the single brackets. The second highest one starts at $183,000. Now, because of their pensions, because of their planning, she's going to be in relatively the same bracket, the same income level. And so now she's going to be paying close to $600 a month for the same Medicare that she was paying 161 year prior to. And then as Matt mentioned, it's not going to happen next year. It's going to happen 2 years from now. Her Medicare expenses are just going to go through the roof. So what can we do to be planning for that? And there's quite a fair amount, which is actually one of my plugs I'll be making for next week when we're talking about tax planning, income planning, health plan, care planning. All of that are necessary legs of the stool to have a solid retirement income plan. Now, I'll go through this quickly. And again, this is available for download in the handouts in the top right corner of your screen. But there's a lot of ways to handle these expenses. The average length of stay in a long-term care facility is right around 30 months. Plus or minus, depending on your gender and depending on the illness in your family's past experience. But one of the ways we can cover this is through what's known as traditional long-term care. Now, this is what most clients think we're talking about when we're discussing long-term care planning. And this is a policy that you pay for it every single month, every single year, and you're going to pay for it in perpetuity for the rest of your life. The other thing you might be aware of is that the cost on this will also increase. Now, to be honest, we offer very little of this. Unless a client really wants to explore this option, we don't really do much of that. Now, over the last decade, more and more options are becoming more popular, as well as work better in the context of an overall plan. One of the most common right now is using life insurance that has a long-term care rider on top of it. This is beneficial for a couple of reasons. The first one is traditional long-term care is use it or lose it. If you pass away at 90 years old and you never got sick, all of that money just went to the insurance carrier. Nobody benefited from it. With this version, because it's tied to life insurance, you paid into it for 10 years, 20 years, or you paid into it until age 100 and you pass away at 90. There's going to be a very substantial death benefit. The proceeds are going to go to your spouse, your kids, a charity. Somebody is going to be benefiting from it. Now, and this is really in like the last year, annuities where you're able to carve off a portion of your assets, put it into an annuity, and that will generate long-term care benefits also with in-home options. 5 years ago, there weren't any in-home options that I was familiar with. Today, there are tied with annuities, and the annuities are very favorable in regards to underwriting. You might have some nicks and bruises on your health record that might not qualify you for the first or second, but annuities might be available. Now, taking a look at the next two, this is kind of where we'll be digging into the advanced planning aspect of looking at all of your assets. One option might be taking a look at a reverse mortgage. You might have your homestead, your kids might be scattered across the country. They have no intention of keeping or maintaining your homestead once you're through with it. Well, a reverse mortgage might be a great way to juice additional income into the household to cover those expenses. The same thing with a home equity line of credit. Most Americans have seen great appreciation in their homestead over the last decade. what can we do to leverage to get our hands on some of that equity in a tax efficient way that allows you to stay in your home. Both of these options might make sense for you. It might not, but this is again where the whole planning conversation goes into place. You might even have some existing life insurance that you might be able to leverage into one of the previous plans. Last thing I'll talk about is you can self-fund. You can use your IRAs. You can use your brokerage accounts to cover it. But Matt mentioned, and we've said multiple times, we believe in informed decisions. Are you aware of all the tax implications of using your own dollars to cover all of that care? Does that impact your partner? Does that impact your inheritance? Is there in another financial crisis, will you have enough steam to cover all of your medical needs? And the last option, if you're here in this room, Medicaid really isn't an option, and Matt will probably shine some light on that as we continue on. But Matt, what did you think?
Great stuff, Ken. Great stuff. Lots of options for people. So hopefully what people take away from that is there's a lot of different ways to address that issue. So thank you. All right, let's get into long-term care planning then. So what do you need to know about it? One of the interesting things, if you look me up on FINRA's broker check or the CFP website, you'll see I've got a bunch of credentials. One of my favorite ones that I earned was the CLTC, which is Certified in Long-Term Care Planning. And I learned so much in there about ways to build a good long-term care plan. It isn't all about insurance, right? It's about looking at taxes. It's about looking at income. It's about looking at, tracking expenses, from a budgeting standpoint when you're dealing with some of these issues. Because when you put all those important aspects together, maybe there's some money you put aside. Maybe there's an insurance policy. You've got some tax planning. You've got some other great tools at your disposal, like Ken was talking about. Suddenly you put that stuff together, and what feels like, a long-term care challenge, suddenly, at least from a financial standpoint, really isn't that hard to deal with. And the reason why people don't plan for it, folks, I'll tell you what, it comes down to one thing, is you don't think it's going to happen to you. And I hate to be this direct, but I'm going to be. You're wrong. You are flat out wrong if you don't think this is going to happen to you. And if you really don't think it's going to happen to you, hey, that's great. You're gambling not just with your life and your spouse's life, you're also gambling with your family's life. We hear a lot of people say, my kids are going to take care of it. And the first question I will ask you if you say that to me is, okay, do your kids know that they're expected to take care of this situation when it occurs? I'll give you a perfect example. In my family, I'm from Minnesota originally. I live in San Antonio. My parents live 3 hours away from Minneapolis, St. Paul. My sister lives south of St. Paul in a suburb. When something happens to my parents where they start needing help, the closest child is 3 hours away. And my own parents have said, oh, Nancy will take care of it. All right. I don't necessarily agree with the Nancy will take care of it, but they've said it to me. They've said it to Nancy. I've got to give them credit. They had the conversation, right? And then Nancy said to me, how am I supposed to deal with it? Okay, one step at a time, right? One step at a time. But from a Medicare standpoint, remember, Medicare doesn't cover long-term care at all. From a long-term care standpoint, this comes down to taking care of you. And there's a lot of things that go into it. Now, you may be thinking, well, I'm not going to get an insurance policy for this, and I don't even want to do this planning because my wife will take care of it. And guys, I'm picking on you directly because that's usually who we hear that from. And I'll just challenge you on this. Let's say you're like me and my wife, late 40s, early 50s. I weigh about 200 pounds. She weighs about 130 pounds, whatever. She probably wouldn't be happy if I said that. But at any rate, today, as a healthy 45-year-old who works out all the time, lifts weights, does all these things, she can't get me out of bed because I weigh 200 pounds. What's going to happen when she's 75 and I'm 80, or she's 85 and I'm 90, or she's 90 and I'm 95? What's going to happen then? She can't do it now as a healthy young woman. What on earth makes us think that she can do it at that point? So the point of having a good long-term care plan, folks, is not to say that your family isn't going to be involved in helping you, get the care you deserve. Your family will be involved. Your family will manage the care. But as we all know, managing something is a lot different than having to go in and roll your sleeves up and get in and actually do the work, right? Your family can manage it. You can bring people in to actually do the work. And in that way, it's not entirely on your family. Okay, couple keys we're going to talk about in terms of long-term care. One, it's not about going to a nursing home. Very few people end up in a nursing home at this point. Most people get care at home. Medicare and Medicaid is not a plan. I don't care. I don't care if that's what you think is going to happen. It isn't. It is, and I'll give you all the reasons why. If insurance is part of the plan, yeah, there were some problems with long-term care insurance when it came out in the 80s and 90s. Thankfully, it's regulated now, and everything is standardized, and it works really, really well. And there's some new approaches. Ken mentioned a few of them. We'll go ahead and jump into them. But first thing, I don't want to end up in a nursing home. Okay. Long-term care is not about just sticking you in a nursing home. Long-term care is about helping you when you can't do 2 of the 6 activities of daily living. Now, here's the 6 right there. Okay, 2, 4, 6. Those are the first ones. Think about that for a second. Bathing, dressing, eating, transferring, toileting. Those first 5, you do all those before you leave the house in the morning. Bathing, you take a shower, you get dressed, you eat some breakfast. Transferring, in and off, or out of bed, right? On and off the toilet, right? All those things. If you need help with just 2 of those things, you qualify to use a long-term care policy. It's pretty straightforward. Incontinence can be a trigger as well. Hands-on versus standby care, that's essentially if you have some kind of issue where you need somebody with you all the time, right? Yeah, that's going to qualify. Where do you get the care? At home, community-based, independent living, assisted living, nursing home. In tonight's presentation, we don't have time to go into all those in depth. Let me just touch on community-based care. A lot of people like that option. Think of that as like a college campus. You come in, the first few years, you're like a freshman, right? First few years, you're active, you're healthy, you're coming and going, and it works great. Then you start to slow down a little bit. You slow down a little bit more, right? It takes you basically all the way through end of life. It can be a beautiful way to retire. It really can, if it works out well. So when you look at long-term care costs, okay, it can be expensive. Remember that Fidelity study that we talked about just a few minutes ago? It said it did not include long-term care. Long-term care can get ridiculously expensive. So we always like to show people a couple key things. First of all, non-long-term care medical costs, about $300,000. Cost of long-term care per year, national median, is going to range anywhere from $51,000 up to $105,000. And we always show this Los Angeles one as an example because a lot of people are like, wow, it's so expensive. Well, El Segundo is right outside of Los Angeles. El Segundo is actually the most expensive market in the US for this. It starts at $70,000 and the median can go as high as $135,000. And folks, that's not even for a private room. That's not even for a private room. So those of you in Houston, up in Plano, in Austin, San Antonio, your costs are not going to be anywhere near this. But going back to what Ken said, we have to put together a good plan that can absorb these costs so that you get the care you deserve. Maybe insurance is part of it. Maybe it isn't, right? Maybe it isn't. What about Medicare? Okay, we know Medicare, and we talked about it already today. Medicare does not pay for long-term care. And here's that term I used earlier, custodial care, right? So these terms can get used interchangeably. You've got long-term care, chronic care, custodial care. Those are different ways of saying the same thing, okay? Different ways of saying the same thing. Long-term care is not covered by Medicare. Medicaid. Some people are like, hey, Medicaid, did you know I have tax attorneys calling me saying, is there an insurance option that would be a better choice than someone putting together a Medicaid trust and putting all their money in there? I mean, I have tax attorneys calling me and asking me that question, right? So first of all, here's some of the issues with Medicaid, okay? And by the way, someone who wants to use a Medicaid trust for some reason, what they're doing is essentially sheltering the asset so that they can qualify for Medicaid. And I've got tax attorneys who think that's a terrible idea. Okay, so surprise number one, have to use up the assets. You got to have limited income. Surprise number two, disqualified due to look back period. I get this question every now and then. Let's say my long-term care is going to cost $10,000 a month, and I have $1 million. Well, I'm not going to qualify for Medicaid, right? I give away my $1 million to my two daughters. Just give it all away. Then I go apply for Medicaid because I don't have any money now, right? I should qualify, right? What they'll do is they'll say, okay, Matt, well, we saw that within the last 5 years, you gifted away $1 million and that your cost of care is $10,000 a month. So after 100 months, 10,000 times 100 equals $1 million. After 100 months, you can come back, and now at that point, you'll be eligible to apply for Medicaid. That's how it works. If the cost of care was $5,000, it would be 200 months. That's how Medicaid works. Okay, so a lot of people are really surprised by that. And it's a 5-year look back. No room at the end or forced to move. You're not going where you want to go. You're going where they have a bed available for you with Medicaid. So just remember, Medicare does not cover extended care, chronic care, long-term care. Again, you can use those three terms interchangeably. Medicaid is not an answer at all. It is not an answer. If tax attorneys are trying to talk their clients out of, sheltering assets to qualify for Medicaid, what does that tell you about Medicaid? You don't want to be on it if you can avoid it. Okay, Ken. What's up for this one? This is our last one, right?
It is. It is that healthcare planning, tax planning, which again next week, income planning, all of those together are necessary for a financial plan. Now, what we're looking at is a household that we helped actually relatively recently. They had a fantastic plan in regards to their assets, in regards to withdrawal rate, everything else, but they were concerned around their taxes and their healthcare. And we're going to spend literally just a second on this. They were projected to spend about $7 million in lifetime taxes, reduced it to about 2.3, saving them just about $5 million in lifetime taxes. By doing that, by their tax planning was helping them with their Medicare planning, reduced their Medicare premiums by about 2/3, saved them about $200,000 and having a huge impact overall to the assets left behind. Now, the thing we want to be thinking about is, okay, I get it. We got to plan for it, but Ken, how am I going to pay for it? Well, most of you have probably had a discussion with your financial professional or even one of your friends saying, my goodness, you're getting older. You're now 60 years old. You're now 70 years old. What are you doing so aggressively invested in the market? You need to move some of your portfolio over to bonds or to cash or to something more safe. Have any of you had that conversation before? In that exact same breath, why do we move money from equities to bonds or from stocks to bonds? It's to reduce risk. It is to protect you from something that might go wrong. Well, stocks to bonds helps you in the financial risks, taking a portion of your invested assets and moving that into some type of long-term care plan, which might be any of the 7 or 8 that I mentioned before, but planning for it to cover those expenses, that in that same way is reducing your risk, because risk comes in many different ways. Now, this current tool we have is one of a kind. I can honestly say that. It is a hybrid policy, but it offers an unlimited pool, a pool that will pay out for the rest of your life, where today most coverage is anywhere from 2 years to 5 years, depending on how it's ultimately designed. But for this husband and wife, they plan for this in their late 50s. We have some clients planning using this plan as late as their middle 70s. Again, it depends on the structure, but for this household, they pay into it for 10 years, not 8, not 12, not 20. They pay into it for 10 years, $200,000 reallocating over their lifetime. And each spouse has an unlimited pool of $5,000 a month for the rest of their life, or $10,000 a month if both of them were needing it. Let me see. Also in this packet that you have is going to have a breakdown of one of our other popular tools, is using a variable universal life chassis where it'll have a $500,000 pool, but it'll have more flexibility for you overall. So many, there you go. So you pay into it over the same 10 years. You might have put more money into it, but it's a larger pool that you have access to. But there's also cash value that's growing over this time period. Now, again, can we save money in taxes by protecting each of you for your medical expenses? Absolutely. And we'll be talking a lot about that for next week. But there are many, many ways to cover some of these very real, very major risks that you and your partner might be dealing with. And all it takes is a conversation. So, Matt, anything you'd like to add?
No. Again, it goes back to the value of planning, right? And making sure that it's all tied together, it's comprehensive, because you don't just save taxes by buying a policy, right? It's how do I fund the policy? Where are the assets going to come from to fund it? Should I be viewing this as I'm buying a policy, or I'm just transferring assets from one tax pool to another tax pool? That's how I'd encourage you to think about it, right? But again, it's a risk that's part of retirement. Put together a good plan and address the risk, and then review the plan on a regular basis. That's all. That's all it is. That's all it is. And Ken, you're gone.
Nope, I'm back.
Is there any such thing as a perfect plan?
Far from it. Far from it. And the plans that we build and that I hope you have are flexible enough to navigate it.
Yeah, exactly. There just isn't. There just isn't. All right, let's talk about long-term care insurance. So you saw the numbers from Ken. You may still be thinking, it's not a good deal. I shouldn't buy a policy. Well, original long-term care came out actually in the 60s, and there were tons of problems with it. Tons of problems. It was seen as by the insurance companies as a great idea. Well, the challenge was that they would have different requirements. Pricing wasn't uniform. There was only one type of policy you could buy. Premiums were never guaranteed, right? There's all these kinds of issues. Well, some of the regulatory reform that started happening in the 90s, things like dementia and Alzheimer's are covered. You don't have to be hospitalized. You don't have to have undergone a period of skilled nursing care, right? Clear terms. You saw 2 out of 6 activities of daily living. All upfront underwriting. Folks, it used to be you'd get a policy that they would double check to see what had changed from when you had bought the policy. That doesn't make any sense, right? Can't be canceled except for non-payment. So in other words, they cannot cancel you for any reason other than you didn't make your payments. And if you buy traditional long-term care, your premiums will go up. Think of it like your auto insurance, okay, or your homeowner's insurance. But those premium increases are regulated. Okay, it's not just willy-nilly. It's not just, the insurance company wants to raise the rates. So can I do the planning? Yes, you can do the planning. All right, you've got the standardized now long-term care insurance policies. Ken touched on life insurance and annuities that have long-term care benefits. He talked about a couple other strategies as well. But going back to the fundamentals, the basic long-term care policy, essentially the way it works is you put the money in and you've got the coverage pool in place. You may or may not have a cost of living adjustment rider added onto the policy. If you buy one of those from anyone, ask for the cost of living adjustment rider. Because if you have 20 or 30 years go by before you need that policy and you didn't have any COLAs built into it, it's not going to do much for you at that point in time. Okay. The other thing too, the benefits are limited to long-term care. There's no life insurance component to it. And that's a big issue for a lot of people, right? Because the improved long-term care insurance is great. It does exactly what it's supposed to do. But what if I just die of a heart attack or in an accident or just suddenly, right? What if that happens? What if I never need the policy? What do I do then? Well, the insurance company says, thanks for being a client. That's it. If you have it tied to a life insurance or an annuity of some kind, what ends up happening then is whatever you didn't use will pay out to named beneficiaries, and you're the person who names the beneficiaries. So that's something that could be a real positive, not just in terms of, hey, the money's going to go to so-and-so, but from your perspective, you at least feel like you didn't throw good money after bad, right? You can do that with long-term care and life insurance. You can do it with annuities and long-term care and annuities. The way it works at its real basic level, folks, let's say you do life insurance. You apply for a life insurance policy, you go through the underwriting. There's a rider that says it can also act as long-term care insurance. You apply for the rider while you're going through underwriting. They come back and say yes or no, right? Like Ken mentioned, maybe you've got some health issues. Maybe you've got a little bit of cash you're sitting on. Well, in that case, then maybe the annuity makes sense because there isn't quite as much underwriting because you're giving them more money up front, right? So either way, though, can be a great option to get you the care you deserve. A couple other things: equity in your home, existing life insurance policies, Roth IRAs, health savings account. So we don't do this, but if you have an existing life insurance policy, you can sell the policy to certain groups, and what they'll do is they'll just write you a check for it, and then now you've got the cash you need, right? Ken touched on equity in your home. Roth IRAs are a great tool. Just remember, Roth IRAs, you can pull the money out for any reason at any time. No tax implications for you at all. Health savings accounts. Hey, those were like Roth IRAs for healthcare expenses, right? After the age of 65, a health savings account money, the dollars in that account can be used for anything without tax consequences. So you heard me say tax consequences a few times in there, right? Don't forget, anything above 7.5% of your adjusted gross income that you're spending on healthcare, which by the way includes long-term care, guess what, is now fully tax deductible for you. And so going back to some of the points Ken made in the breakout sessions, when you think about pulling all this together, maybe I've got some Roth IRA money. Maybe I buy one of these policies, whether it's the improved long-term care, the life insurance version, the annuity, whatever, right? But I buy one of those. I also have some tax advantages here. Hey, suddenly this is feeling manageable, right? Because I know I'm going to get some tax breaks. I know I've got some insurance in the mix. I also know I have some investments that can help me manage this. Hey, I put the three together. That's a three-legged stool. I've got a great plan now. But folks, I'd say the key is work with a certified financial planner because we're the only ones qualified to look at all three of those aspects. Okay. Self-funding, if you've ever heard of the term sinking fund, we have a lot of people who do this. They'll put together an account, we'll manage the account for them, and that account is projected to hit X amount of value by, say, 85. That's their long-term care fund. All right. As we get closer, 80, 85, we'll probably get more conservative in the investment philosophy because, again, like Ken said, we don't want the market to do this and then suddenly, something happens and you need the money and you only have half as much as you thought you did. That's why, folks, what you'd want to ask us about if you're really interested in self-funding, non-correlated assets. Non-correlated assets. Assets that at a minimum will not go down in value when the market declines. That's what you're looking for a self-funded long-term care fund. Other factors beyond money, okay? Age, marital status, it's all there, right? It's all there. I would actually say the marital status, age, family, that's the biggest one. You've got to have your ducks in a row there, right? You could get the insurance. You could have us help you with the insurance, the tax, put together the sinking fund, to self-fund it, the whole thing. But if your family's not involved in the conversation in a meaningful way, when something happens, you're in trouble. For example, do you have your durable power of attorney? Do you have your medical directives in place? Are they current? Have they been updated? Right? If you got divorced, do you want your ex, who maybe is on the form, to still be the person calling the shots for you? You might or you might not, right? So again, I just added a legal wrinkle in there. So if you're wondering why should I attend, 2 weeks from now for the estate planning workshop, we're going to talk about that there as well. But again, when it comes to a safe and secure retirement, it is a lot to think about. Three main questions: who's going to provide the care? Who's going to do the work, right? Where do you want the care? You probably want it at home. How are you going to pay for it? You're going to pay for it by putting together a good plan. Okay. No two plans are the same. Get your care at home if you can. And remember, remember what I said about taxes, insurance, savings, put those three together. Your plan doesn't have to cover all possible costs. It just needs to cover enough of them to make sure you can protect your dignity, protect your lifestyle, and not be worried about money, right? That's what your plan should ultimately do for you. Okay, we're right at the top of the hour. Actually, I'm a minute over. Apologize. We tried very hard to be respectful of everyone's time. Tonight was managing healthcare expenses in retirement. Next Monday, the 13th, is tax planning. And then Monday, the 20th, is estate planning. For those of you who are interested, we do have that great relationship with Savers, and make sure when you're talking with us, if we don't bring it up, to ask about Savers, okay? Because they do a great job, and we're so busy on financial planning and all that, every now and then we forget to say, oh, by the way, did you want Savers to contact you? We have a preferred relationship with them. If you want that real high level experience, right, that great customer service, you got to go through us to get to Savers Marketing. Okay, so let us know if you're interested, either from a health insurance standpoint or from a Medicare standpoint. It's worth a phone call. It's worth a phone call. But otherwise, thanks again, everyone. I'm Matt Donahue. Ken Hamilton did a great job on the breakouts tonight, and we will see you all next week. Thanks again. Bye-bye.